these we will set up with just a pair of gloves. We'll just open glove and set things up. This isn't a sterile procedure per se. You know, the gown and gloves are more protection for us than anything. So facility policy, you know, whatever they, sometimes if it's gonna be a minute, I'll just open up my stuff, throw on a pair of gloves, set up, and then when the patient comes in the room, I'll scrub in, like really scrub in. We're going to use the Mayo stand during the DNC, so you guys don't have to monkey with that. We'll have two specimens, an endocervical specimen. So they're just going to take some curettings, right? So they can test the tissue for diagnostic or treatment purposes or whatever. These towels are like shrunken heads.
So whenever you lift up the ChemGuard wraps, you want to have the blue towards you because it's a lot easier to see through for holes, and double check a lot of times the edges on where the trays were, but we're good.
Okay. All right, welcome to the DNC tray. I'll talk to you a little bit about what's on here. Open sesame. Okay, I think I can count stuff when you're ready.
Ready.
All right, Raytex 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
10 right there.
And then blades, I have 2, 1, 2, 2, and that's it.
Nice.
And then I'll take some saline if you don't mind.
So I have 0.9% sodium chloride, 500 milliliters, expires 8/21.
0.9% sodium chloride, 500 ml, 821. 0.9. What is the 821?
8/20.
Voila. Thanks. This is mainly for just washing up afterwards, like wash that prep off that Mrs. Stolt did such a good job of putting on there. Okay, so some other stuff I have Telfa, which is going to be for my specimens, and usually it comes like this. You just like cut it in thirds, and then you'll use 2 of those. Okay. So some things we have in here, this is the weighted speculum or Avard speculum. This just hangs inside the vaginal opening posteriorly, and gravity helps to pull it open. Look at her face, she's like, and then sometimes you might have an extra glove on the preference card, like a 5, 5.5, 6, something that's small that you would slip over here. And then as this is hanging in the vagina, if you know blood or tissue can run down this track and into the glove and not into your surgeon's shoe. It's preference what the surgeon wants to use. More often I see this one, and this is called the Graves speculum or the duckbill speculum. All right. Whack. Okay, so that's what they're gonna want first. Oh. Could I get some jelly? Were you trying to give it to me and then I didn't? I'm sorry.
I would wait.
You should have just been like, "Rawr."
Do you really want me to do the jelly?
Sure, you can.
See it? Alright, So then we would squirt some out. Do you want me to just? Sure. So you want to squirt a little bit out of the top before you give it on the field. Let me just do look at that.
So this is what we're going to run our instruments through so that they don't hurt the patient so much. I'll just like stick it over here in the corner. Okay, thank you so much. All right, so before you would give it, you know, pass it to the surgeon. So they're going to put that in to get their visualization. Do you like the Dr. G?
I do.
Okay. All right, so that'll be the first thing. Next is going to be the single tooth tenaculum. It's called single tooth because it has a single tooth. It looks kind of like a towel clip, right? But this is going to be to grab the cervix. So we'll use this to grab the cervix, lock that on the cervix so that they can get some traction as they're dilating, right? Because this is dilation and curettage. So they're going to dilate the cervix to get into the cervix to take some tissue, and then dilate it a little bit more to get into the uterus itself to take their second biopsy. All right, within the cervix, that specimen is endocervical, and then within the uterus, it's endometrial, because that's the endometrium, is that inner lining.
Mm-hmm.
Okay, so they'll put this on, and then some of them like to know what the uterus sounds like.
Nobody laughed.
This is called a uterine sound, and it is to get an idea of the depth from the back of the uterus, or the top, the fundus of the uterus, right? From inside, so it's going to go inside the cervix. It'll palpate the back of the fundus, and then where the cervix ends, this has measurements on it. I don't know if you guys can see it. Oh, yeah, see the little measurements there. I see them.
Oh yeah. Mm-hmm.
So, not that it's not important when we're doing a regular DNC, but if they're doing like an endometrial ablation, that's one of the measurements that the nurse would program into the machine. So, the sound. So I'm going to do that next. No, it's not going to fit. Okay. And then after that, they may use a couple small dilators. So we decide these were Pratt's. There's usually a variety of them. Probably not going to use really ginormous ones, but they are, if you look at them, one end is smaller than the other, and they're just graduated up every single one. Most of them have numbers like 9, 10, 11, 12, 13, 14. When you pass it, you want to swipe it through your jelly and then put the bigger end in the surgeon's hand, because they'll want to use the small end first, and then they'll switch and they'll use the bigger end, and then, you know, they might, however big they want to go up, right? They'll let you know. Okay, so they're going to dilate it just a little bit, and then they're going to get their endocervical curettings, and they're going to use a small curette, and a lot of times they'll use this really small one that's called a Kevorkian curette. Square on the end. Okay, so they can use that to take their first specimen, and I just paratelpha with it. All right. Then they might dilate a little bit more to get into the uterus, and once they're into the uterus, they're going to take a different kind of curette, but they'll tell you which size. So the tray usually has a variety. These are called Sims intrauterine curettes. Another telpha, I'll pair there. All right, we're nearing the end. When they get done, or maybe intraoperatively, if there's some bleeding, they'll use a sponge stick. So we'll practice making sponge sticks, but there's a couple ways. There's the diaper fold. So if you have the sponge on a diamond, right, and you fold the corner kind of up to the middle, lay your sponge stick, stick all of your corners in, voila, the diaper fold. Okay, there's also another way. You can tri-fold it, so a third and a third. Fold it so the little blue stripey is out. What does that blue stripe mean?
Indicate the, like if it's left inside the
Yes.
cavity.
That's that radiopaque strip, right? X-ray can detect. So this is the other way. We've all decided we don't really like this way, but maybe the surgeon does. So, you know, you can do them either way. There's a scissor in here. Usually it's a suture scissor, or it might be something else, to cut the telpha, or every once in a while, like when they take the tenaculum off, it'll be where they put it on the cervix, it might be bleeding. So they might want to put a stitch. So you'll probably have a needle holder. This is just a Mayo Hagar. And then a forceps. Dr. Windsor likes the forcep. I don't know if Dr. G does. And then you might have some other random retractors. This is a Haney retractor. It's just a right angle. Sometimes they have like a, right? Haney? Eastman. Okay, sorry. This one's an Eastman, but there are like Haneys that are like just long, skinny kind of right angles. So you might have those. There's a Sims in the other other tray that's kind of like a little curvy guy like that, kind of like a Sigma. Not a Sigma. Fine. Okay, so that's pretty much it. Questions so far? Okay, let's talk about the draping. Sometimes the surgeons will like towels to put over the thigh. I don't remember how to do them. No? What is it?
Offset the corners.
Just grab- yeah.